Well, once a doctor, always a doctor. This line is apt to describe Silchar MP Rajdeep Roy, who despite handling the responsibilities of being an elected member of parliament, has not forgotten his oath as an orthopedic surgeon. Dr. Roy conducted his last surgery as recently as last week, taking out time from his busy schedule. And this is not the one odd procedure conducted by him. In fact, Dr. Rajdeep Roy carried out as many as 30 to 35 surgeries in the first wave of the pandemic. Well, Northeast Live got in touch with the Silchar MP to know its first hand as to how he juggles between the two roles, both of which are extremely demanding. So viewers, now let's listen into this exclusive conversation.
We welcome Dr. Rajdeep Roy. Sir, we want to know from you. It become very impossible for the people many times when they have a huge responsibility in their shoulder. As a doctor and as a parliamentarian, how you are handling these two things?
It's a very good question, but I have been doing it for a long time. It's almost 25 years now that I am basically juggling with my profession and my passion. By training, I am an orthopedic surgeon, and my area of interest is to do spine surgeries and hip and knee replacements. But I do basic orthopedics, which is fracture and trauma. And since last almost 12-13 years, I have been in active politics. But before that also, when my father was an MLA, I used to help him in active politics once in a while. But I devoted a lot of my time in getting training from best institutes of the country and best hands, from the best hands. To be honest with you, I don't think too much. Both of them are 24/7 job. In politics, you need to be beside people most of the time. Manuhor logot thakibo lage, manuhor usorot thakibo lage. Aru jibur issues মানে ইমাৰ্জেঞ্চি ইস্যুজ হয় তেতিয়া যদি পলিটিচিয়ানক নাপায় তেতিয়া অলপ পলিটিচিয়ানৰ ডিছক্ৰেডিট হয় ঠিক তেনেদৰে similarly when a person comes to you in acute pain or with a fracture or he or she needs a surgery, they should get the surgeon who's willing to operate, who's willing to take responsibility for good treatment. So you have to do both. So as a person and as a professional, I try to do justice to what I have taken oath for, my Hippocratic oath. And as a politician also, I try to stay with the people for most of the time. That's how I have been trained. Hopefully, despite my busy schedule in the parliament sometimes and in public life, nowadays COVID is going on, the pandemic is on, you are aware. I still try to devote time to my patients, listen to their complaints, and there are few patients who I've been seeing for a long time, so they want my advice once in a while. And as a doctor also, almost I am answering almost 15 to 20, sometimes 25 calls in a day, just medical related calls I am answering. I write prescription, I give them advices, I talk to the appropriate authorities to get them the best advice sometimes. So that's been my job. Despite being in parliament, I have not left profession.